What if I told you that a single weekly injection is helping some people lose 15, 20, or even 30 kilograms? What if I also told you that some people are experiencing nausea, muscle loss, and even a condition now nicknamed Ozempic face? And here's the most surprising part. Ozempic was never designed as a weight loss drug in the first place. So why are millions of people using it? How does it actually work? Is it a miracle drug or just another health trend? And most importantly, if you stop taking it, does all the weight come back? Stay until the end, because the answer to that last question surprises almost everyone. Hi, I am Dr. Ohm. Ozempic has become one of the most talked about medications in the world. Celebrities use it, social media influencers promote it, doctors prescribe it, and many people are now asking the same question. Should I take Ozempic for weight loss? Before making that decision, let's understand exactly what this medication is and what science says about it.
Ozempic is the brand name for a medication called Semaglutide. It was originally developed to treat type 2 diabetes. Patients with diabetes who started taking Ozempic noticed something unexpected. They were losing weight. Not just a few kilograms, some were losing significant amounts of body weight. Researchers became interested. Clinical trials were conducted, and the results were so impressive that semaglutide was later approved in a higher dose specifically for weight management. But how does a diabetes drug make people lose weight? The secret lies in a hormone called GLP-1. Your body naturally produces GLP-1 after eating. Think of it as your body's "I'm full" signal. Ozempic mimics this hormone. It works in 3 important ways. First, it tells your brain that you're full. This means you feel satisfied with less food. Second, it slows down how quickly food leaves your stomach. Food stays in your stomach longer, so hunger returns more slowly. Third, it helps control blood sugar levels. This is why it was originally used for diabetes. Imagine this. Normally, after lunch, you might feel hungry again in 3 hours. With Ozempic, many people report feeling satisfied much longer. The result? They naturally eat fewer calories without constantly fighting hunger. Now comes the big question. Does it actually work? The answer is yes, and the evidence is strong. Large clinical studies found that people using semaglutide, along with lifestyle changes, lost substantially more weight than people receiving a placebo. Many participants lost around 10 to 15% of their body weight over time. Let's put that into perspective. If someone weighs 100 kilograms, losing 15% means about 15 kilograms. That's a significant amount of weight. This is one reason why Ozempic and similar medications have completely changed the way doctors think about obesity treatment. Because obesity isn't simply about willpower. For many people, biology, hormones, genetics, and appetite regulation all play important roles.
Now here's the part many social media videos skip. Ozempic is not magic, and it's not risk-free. The most common side effects include nausea, vomiting, diarrhea, constipation, stomach discomfort. These symptoms are often worse when treatment first begins. Another concern is muscle loss. When people lose weight rapidly, they don't just lose fat, they can also lose muscle. That's why doctors recommend adequate protein intake and resistance exercise during treatment. And then there's the famous term Ozempic face. When people lose weight quickly, facial fat can decrease, making the face appear older or more hollow. This isn't caused by the drug itself, it's a consequence of rapid weight loss.
So what happens if you stop Ozempic? This is where many people are surprised. Studies show that many individuals regain a significant portion of the lost weight after discontinuing the medication. Why? Because the biological mechanisms controlling hunger start returning toward their previous state. In other words, Ozempic helps manage weight while it's being used. It is not a permanent cure for obesity.
So, is Ozempic a miracle drug?
Not exactly. But it is one of the most effective medications ever developed for obesity treatment. For the right patient, under medical supervision, it can be life-changing. However, it's not a shortcut. Healthy eating, physical activity, adequate sleep, and long-term lifestyle changes remain essential. Remember, the goal isn't simply to lose weight. The goal is to improve health. I'm Dr. Ohm, and this is Health Decoded. If you found this video helpful, subscribe for evidence-based health information explained simply. And tell me in the comments, would you consider taking Ozempic if it were offered to you?